This is the low-power histological appearance of a very rare tumour called an epithelioid sarcoma. More histology later after some facts about epithelioid sarcomas. Epithelioid sarcomas are rare tumours, accounting for only 1% of all sarcomas. They occur more frequently in males than females, approximately twice as frequently in males than females, and tend to affect adolescents and young adults, with the usual ages being between 10 and 39 years, with an average age of 27 years. Epithelioid sarcomas may be subdivided into those that occur distally and those that occur proximally. Distally means occurring in the extremities of the body, whereas proximal means occurring more centrally. And, as the name implies, epithelioid sarcomas are called epithelioid sarcomas because of the resemblance of the tumour cells to epithelial tumour cells or epithelial cells. Epithelioid sarcomas may be subdivided into two basic categories. There is the classic type, and these are the distal epithelioid sarcomas, and these tend to affect young people and involve the fingers and hands in 60% of cases, and also the feet, lower arms and lower legs. And then there is the proximal type, and these are less common than the distal type. These tend to affect adults and involve the chest, abdomen, head and neck, vulva and penis. Risk factors for epithelioid sarcoma include the SMARCB1 gene. There is a reported association with trauma and radiation, and a number of syndromes and conditions are associated with epithelioid sarcoma developing. There are a number of syndromes and conditions associated with the development of epithelioid sarcomas, and those include Gardner syndrome, neurofibromatosis, retinoblastoma, Li-Fraumeni syndrome, tuberous sclerosis, Gorlin syndrome and Werner syndrome. Epithelioid sarcomas present either as a lump, an ulcerating lesion, or sometimes pain. And the distal ones would tend to present earlier because they will be more obvious than the proximal ones that may be buried deeper in the body. Grossly epithelioid sarcomas tend to be 3 to 6 centimeters in diameter, although they can vary from just a few millimeters across to 15 centimeters or more across. They have an indurated, ill-defined appearance and occur in the dermis or subcutaneous tissue in the distal types. The cut surface is pale or grey and glistening with areas of hemorrhage and necrosis. Histologically, epithelioid sarcomas have a nodular configuration with polygonal epithelioid tumour cells with abundant pink staining or eosinophilic cytoplasm. Another cell type seen in epithelioid sarcomas is spindle cells with areas of desmoplasia or fibrosis. Another feature of epithelioid sarcomas is the presence of a necrotic centre resembling infectious, necrobiotic and granulomatous conditions. Useful immunostains for epithelioid sarcoma that tend to show positive staining include EMA, CAM5.2, Vimentin, CA125 and CD34, and stains that tend to be negative include S100 and desmin. Prognosis of epithelioid sarcomas depends on the type, so the distal ones tend to have a better prognosis than the proximal ones. The distal ones tend to be smaller than the proximal ones. The tumour cells tend to infiltrate quite widely, so they can be difficult to excise completely and therefore may recur. And if they spread, they tend to spread to the lymph nodes. Distant metastases tend to be a late event, and the usual site for metastases is the lungs. And interestingly, epithelioid sarcomas may also metastasize to the scalp for some reason. This is the low power histology of an epithelioid sarcoma again. You can see a number of things at low power. Number one, it is quite an ill-defined, rather nodular looking tumour. Number two, there are areas of hemorrhage and necrosis, and as we move towards the surface of the skin, you can see that the tumour is ulcerating and breaking through the epidermis. On higher power, you can see that at the edge of the tumour there is a lymphocytic infiltrate, and the tumour is composed of cells, predominantly polygonal epithelioid cells with abundant pink staining cytoplasm, and a smaller component of more spindle cells. And here is a higher power view of this epithelioid sarcoma, composed of epithelioid cells that are polygonal with abundant pink staining cytoplasm and pleomorphic nuclei, and scattered amongst them are spindle cells. Epithelioid sarcomas are malignant tumours, and finally we are zooming in to a mitotic figure at the centre of the screen.